I actually applied to NASA at one point. I wanted to be an astronaut, but I went to medical school instead. But we see the rocket launch, but before that rocket ever launches, so much work goes into it. So that's, I think, what I'd like people to understand, is that the operation is the most gratifying part of the journey we go through, but in truth, it's much grander than that. And then the other piece of it is it's the one place where your hands actually heal. So I think maybe that's what defines me as a surgeon, is that as I was training, I actually understood that very early on, is where my hands make a difference. So not to say my colleagues don't make amazing differences in our patients' lives. They actually are able to cure patients where I can't when it comes to treating their bodies. But it's the one place where I can come home at the end of the day and know that my own hands were laid on the patient, and that resulted in either a cure or palliation, which is to relieve their pain or discomfort if we can't outright cure them. So I happen to love what we're doing. There are as many variations of cancer as there are people on this planet. And so with that said, the defect in the cell that leads to this cancer is so unique and different in how we approach it. And so even my own husband says, "You've made so many advancements, why haven't you come up with a cure for cancer?" Because it's not a universal cure. We used to initially take off as much as we could and hit people with every drug under the sun. And we started pulling that back and de-escalating that therapy and have it be more appropriate and personalized to the patient. So it's a different disease for every single human being. And we look for patterns and we look for groupings and different things that work for certain cell types or body areas. But the reality is they're very unique, just as the individual is. For patients that don't need extensive operations, they can have more limited surgeries, quicker recovery times. They're able to get back to their normal lives sooner. For patients that don't need chemotherapy as well, less toxicities, less long-term effects. So it's very helpful. And for the patients that we now are identifying need these more extensive treatments, it actually has fortified their desire to engage in them, because we have so much data backing their care and saying, you are going to benefit from this, as opposed to it may or may not help. So it helps them get through tough times when they know it's very selective and very personalized to their own particular problems. So that's been a big shift over the years, and I'm very pleased with that shift. I love working with the patient. I love working with my staff. I can't imagine a job that offers so much diversity, yet at the same time continues to just blow up your mind. I mean, the reading, the conferences, the discussions. I can't not do this. It might be a while before I can retire, because I can't find a replacement for taking care of the patients in this way, and to give me my own personal growth that I obtain every day from it.